10 when you come to the year 2022. So this is one of the reasons you can tell your or motivate your smoker friends to stop smoking, that you are not only harming yourselves, but also your near and dear ones. So smoking kills, and this is clear. These are some other risk factors for cancer, and there are some modifiable risk factors: tobacco, alcohol, certain viral infections, sedentary lifestyle, obesity, a high-calorie Western diet. So these all factors are there, which is actually the paradigm of this modern era, and we really need to, take steps to actually counter them. Another question is that my uncle was treated at a hospital. He didn't require surgery and he still got cured. Then why are you insisting for surgery of my patient? So the answer is the treatment for all cancers same? So answer is that cancer is not one disease. You see in the body, there are different organs, different body parts, and each of them can develop an individual cancer where the treatment would be absolutely different from one from another. That is why it is such a specialized branch. So it's a group of different diseases with different modalities of treatment, different prognosis, and very different cure rates depending upon the site of the origin and the stage of the disease. So a very common question which is asked is, what are the warning signs of cancer? So this is something we should really understand and know, because this is very commonly asked to me wherever people find me that I'm a cancer expert. So these are the 7 warning signals of cancer, which would be a change in the bowel or bladder habit, that is alternating constipation, diarrhea, or urinary complaints. There might be a sore which does not heal. There might be unusual bleeding or discharge either from any of the orifices, like bleeding per vaginum, rectum, or maybe oral cavity. Thickening or a lump in the breast or elsewhere in the body. Difficulty in swallowing or indigestion. There is a wart or a mole on the body which is changing. It might get absent. Even if it is getting absent, it is a sign that it needs to be evaluated. And nagging cough or hoarseness is one of the other thing which are amongst the 7 warning signs of cancer. And if any of these signs are there, you must consult any expert for the same. Now, because the other thing is, how is cancer diagnosed? So we all understand there is something known as a biopsy, where we take a tissue piece, but there is a big myth that cancer spreads as a result of biopsy. So this has been proven by multiple trials that cancer does not spread as a result of biopsy. So one should undergo a biopsy whenever the patient has been told to do so by the treating doctor. Another very common thing is these days the pathological labs are offering packages where they offer this hemogram, kidney test, and liver function test, and people have a tendency to get these things tested. So if these tests turn out to be normal, then they tend to ignore any other symptom in the body. So the question is that these tests still might be normal, but if you have any of those 7 warning signs, then you need to consult a doctor. Just don't rely on these CBC, KFT, LFT to rule out a malignancy. In every malignancy, these tests are not actually altered. It is only in the late stages that these tests get altered. The question is that once diagnosed with cancer, some patients are in a hurry that you should start your treatment immediately. Is it so? So answer is no. One has to understand the origin of the disease and stage of the disease, and then only decide about the treatment. So what are the stages? There are 4 stages. Stage 0, 1, 2 is very early stages. Stage 3 is something like a locally advanced, where you can say that the disease has reached the border, India-Pakistan border. And the moment the disease has gone somewhere elsewhere, it has known as a stage 4, or it has metastasized. Now we want to prevent the stage 4 disease, because once the disease has gone outside its local premises, then it would be difficult to control. So it is very important and apt to treat the patient as soon as possible, because at that point of time, the chances of cure rate would be higher. Secondly, the modalities and the treatment would be less as compared to any patient who would be in an advanced stage. So is surgery advisable in all cases? This has already been answered. Is more always better? No, depending upon what are you dealing is important. And is all surgery always the first option? Not at all. It would depend upon which malignancy and what stage you are dealing with. So this is a question I wanted to keep up, because these days, breast cancers are very common, and people are generally have a tendency to understand that if they remove their complete chest, which is modified radical mastectomy, or they just only go for a lump, would it make a difference in the outcome? So the trials have shown that even if you remove the small lump and don't go for a complete removal of the breast, the results are equivalent. Radiation, people feel that you want to burn me. It is not. It is an ionizing radiation where there are only skin changes, but they are very focused, so that as to really, target the area which is to be radiated. Now comes the question of chemotherapy. And, whenever I talk about chemotherapy, I'm a chemotherapy expert. People feel that I'm talking something like about a poison, something like a rat poison. But let me tell you, chemotherapy is any drug which would go inside the body and would kill a cancer cell. So you have different antibiotics like ciprofloxacin or amoxicillin, which would go inside the body and kill bacteria. In a similar way, there will be different drugs which would go inside, and when given, they would kill the cancer cell, and those would be known as chemotherapy. So people use methotrexate drug for arthritis. When I use it in my cancer patients for the treatment of cancer, it is a chemotherapy for me. So you need to understand chemotherapy is not one drug, it is an umbrella where you have different sort of drugs with different side effect profiles. So the question is chemo painful? So this is a big myth. It is an absolutely painless procedure. It is like giving some IV fluid, which normally patients also receive. Are there any long-term side effects of chemotherapy? There are, but now with research, we know where to curtail and keep it short so that these long-term side effects are not there. Patients feel that once they start on treatment, they'll be placed under house arrest. So believe me, there is no CBI against you that you need to be put under house arrest or the patient needs to be put under house arrest. The patient can very well resume the office the next day. And the other thing is that there is an era of these new targeted therapies. So what are these new targeted therapies, and are they available for all types of cancer? So there are some drugs which act on the surface of the cells where you can specify a target. Now, they target specific receptors. So what happens is that they will attach only on those receptors and kill those cells. So they will be very well targeted and they won't affect the other cells. These are known as targeted therapies, and they are not available for every malignancy, but yeah, they are very specific for the malignancies which are there. So this is something like personalized medicine these days. Believe me that if I have two patients of same age, height and weight, both suffering from same stage of breast cancer, maybe the treatment for both of them would be absolutely different, because these days we do not go only to the stage of the disease. We understand the biology of the disease. We do tests to understand the aggression of the disease, and we make the treatment tailor-made. So it is not these days that the treatment is blanket, that somebody has a fever, so you also take crocin, I also take crocin. It is very personalized therapy in malignancy these days with the amount of research which has gone. So a point or two about the slides, something known as cancer screening. So one of the big myths, screening is for normal individuals. Okay, screening is not for the suspected patient or for a patient. Screening is for a normal individual like you and me. So any person who is absolutely normal would go for a cancer screening as per the protocol. And what are the protocols? I would tell you. So this is something known as a mammography, which is suggested for every lady after the age of 40, which is nothing like just an X-ray of the breast. In India, no one gets it done. Even in my family, I have to persuade them to get it done. But this is very mandatory to get it done, because it would pick up breast cancer at a stage where it will be absolutely curable. And if I tell you, a very close relative of mine just underwent a routine testing, found out to have a breast cancer, a very aggressive cancer, but because it was picked up in a screening, the patient is absolutely normal, and it has been now 2 years since then. So that is the importance of screening, and screening is for normal individuals. So mammography after the age of 40 annually to be done in every lady it should be done. So this is basically the American recommendation of ages. So they say 45 is must, everyone should get done. Ideally, after 40, everyone should get a mammography done. Then there's something known as the cervical cancer screening, and believe me, there are so many cases in Haryana of cervical cancer that I really doubt that what is happening. But if somebody goes for a simple test known as pap smear, which is just putting a slides and smears, this disease might be detected at a stage when nothing, with minimal treatment, this would be curable. Another is for prostate and for lung. I'm not going into details for the same. This can be, only the thing to be said is that if somebody has been smoking for long and has been smoking heavily, then the patient, in spite of having no symptoms, should undergo a screening by talking to a specialist. Lastly, people also talk about something like a vaccine, and they said that there is a vaccine available, so it is available only for cervical cancer, and it has about a 95 to 97% protection rate. It is given only in 3 doses. Any lady from the age of 9 to 42 years of age can take these vaccines, and preferably it should be given before the first sexual exposure, but even can be given even after that. So this is something the message should pass on, that girls and ladies who have not taken this cervical cancer vaccine should really take this, has a protection rate of about 95 to 97%. So the question comes, is it a curable disease? So believe me, cancer is curable if it is picked up at the right time. The problem is we miss it at the right time because we do not consult a specialist at that time, and we only consult when the disease has spread and has gone far beyond. So cure of cancer is possible by adopting means of screening as well as treating it appropriately at right time. So I started by saying that cancer is a scary word. I would end by saying that cancer is just a word and it is not a sentence. So have we really made the difference? This is how the cancer survival is increasing because of new research. And then a slide about our facilities. This is the latest Versa machine for PET scan, the Versa HD machine, the radiation machines, where we have a complete center, the state-of-art center to control and cure the malignancy part. So thank you, and I'll be happy to answer any questions if there are.
Yeah, thank you so much, sir. With a deep sense of appreciation, we really thank you, sir, for talking about these myths and the real dangers that are there. And it was indeed an eye opener as to how important it is to go for checkups and screenings regularly. And the way you shared all this information, sir, is really commendable. The house is now open for question answers. So if any student, anyone in the audience has any question, they can ask their questions, and sir would of course help them.
Questions are also coming on the message box, ma'am. So I think we can
right,
pick
sir,
some from there.
I can, yes, read them. Okay, sir. So Aditi ma'am is asking a question. Can we go for PET scan without any symptoms also?
So see, why should you go for a PET scan without any symptoms? There is no reason to go for it. Because there are some screening. The screening tests are always done which are convenient and economical. PET scan is a comparatively higher test, so it is not adopted for screening. PET scan would only be advisable if you have symptoms and if your treating doctor feels that you should undergo it. It is not for a routine test.
Thank you, sir. Thank you. There's one more question by Vishnu Gupta. He wants to ask if about sodium fluorescein microscopy.
So sodium fluorescent microscopy is something to detect these viruses and these bacteria. I'm really not into the details of the same because this is not my field. I think that he would be better off talking to a microbiologist to understand those, because this does not really come into my forte.
Actually, this is a microbiology student only, I guess.
Okay. So, but then he must be knowing more than me regarding this.
Another question by Yashu. She wants to know what are the risk factors in using oncolytic virus therapy?
So oncolytic virus therapy is under evaluation, not yet approved for majority of the testing. The only thing whenever you are using such sort of therapy is that that virus, whichever you are using in the form of an oncolytic agent, should be the one should not be causing the damage to the body and the disease itself. So it has to be a very safe process. And whenever these tests are conducted, they are conducted either in the lab or in the animals. So there's always a chance that their behavior, the biological behavior, might be different in a human individual. So that is why it has to undergo a rigorous testing before these are approved.
Right. Thank you, sir. Any other questions you can ask yourself?
Sir, I have a query.
Okay, Himanshu, go ahead.
Sir, I want to ask that should we trust on online remedies in case of any emergency?
You should trust on online.
Sir, can we trust on online and remedies that in case of any emergency?
What do you mean by online remedies?
लाइक सर कभी कभी ऑनलाइन रेमेडीज दी जाती है कि अगर आपको कभी हार्ट अटैक आ रहा है तो आप ये कर सकते हैं तो आपको मतलब उसमें हेल्प मिलेगी तो कैन वी ट्रस्ट ऑन देम?
देखिए बात ये है कि सी द थिंग इज दीज डेज द थिंग्स आर नॉट सो स्ट्रेट फॉरवर्ड. Even in a case of a heart attack or maybe in a case of a cancer, the things are so in terms of the biology of the disease that there is no blanket treatment. So why should you go for an online treatment? Why don't consult an expert who would guide you better? So I really don't think that is right, that just on the base, because if you go online, you will have all sort of informations. Try to search for something on the net today. You'll get 100 different therapies, even which I won't be aware of cancer. So people can put anything on the net, and what is the authenticity? So I really don't think that that is the right way to go about treating any disease.
Thank you, sir. Lakshana ma'am, you can ask your question.
Thank you, Ruchika ma'am. Good afternoon, sir. Very eye-opening session, sir. Sir, I wanted to know that what is the risk of what is the probability of having this cancer in this time right now in India? Like, is it increasing from the last few years or is it constant? What is the probability?
So the most of the cancers which have been there have been increasing in incidence in India. Now, there can be many reasons which can be attributable for the same. One is obviously our lifestyle is changing. We are getting more westernized, which is not actually considered to be a very healthy lifestyle. Secondly, a very major important reason is that we have much more better diagnostic modalities at our disposal at the moment. Previously, people used to have diseases and they just used to suffer it and succumb to it. Now we are actually able to diagnose a disease and you make up come with a diagnosis. Secondly, the incidence of smoking and other things are also increasing. Alcohol, smoking, and everything is increasing. I'll tell you a very interesting fact, and that interesting fact is that in worldwide, you see that the incidence of male smoking has reduced. That is why the lung cancer associated with smoking has reduced in males. But in contrast, the incidence of female smoking has increased. So the incidence of cancer associated with smoking is increasing in girls. So it is basically a paradigm shift in terms of our, habits, our way of teaching, our environment. Obviously, pollution also contributing to the same. So incidence of every malignancy has been increasing in India, and there can be so many reasons for it. But the only thing is maybe it is the right time to spread the awareness for the same.
Yes, so you just said that the incidence of cancer in Haryana, you said, is very high for cervical cancer. So that made me think.
It's very high. So the reason is, I don't know, there might be some cultural practices for the same, maybe some reasons for the hygiene. Not to say I'm not referring to anyone, but there is some sort of polygamy involved in that case also. And major reason one I would say is that a lack of vaccination. People do not want vaccination. So that is the issue where I get a lot of patients of cervical cancer from Haryana, especially from the rural population. And cervical cancer is known to be in the rural population.
Okay, sir. Thank you so much, sir. Thank you.
Thank you, sir. Sir, do you have enough time to take more questions, or should we stop?
Sure. Please go ahead.
Thank you, sir. So, okay. Aditi ma'am again asks a question about just lost the question.
Can I ask Ruchika for
Yes.
one question?
Yes, ma'am.
Good afternoon, sir. It was a nice presentation and very informative. I just wanted to know that if somebody is suffering for cancer and that person has gone for biopsy, is there a chances of that biopsy leading to more formations within the body? Does it spread because of biopsy? Is it a myth or is it a reality? I would like to know that, sir.
So actually, I had covered this point elaborately in my presentation, that this is a very big myth where by repeated studies it has been shown that biopsy does not lead to the spread of cancer, but people still actually believe the same. But it has shown in nth stubborn number of studies that this is not the case. So one can undergo a biopsy safely to establish a diagnosis.
Thank you very much, sir.
Ruchika ma'am, you are on mute. Yeah, thank you, Akanksha. Thank you, sir. So another question asks, preventive steps or tests except mammography, and at what interval should mammography be done?
So mammography should start at an age of 40, not more than 45. It should be done annually for an individual at normal risk like any of our relatives. Then, screening is for every malignancy, which would depend upon what risk profile the patient is coming out with. So as I had told previously also, that if somebody is smoking, which is something known as a pack use, so one cigarette per packet daily, is one pack year.
Ma'am, please mute.
Supposedly, patient is somebody is taking 3 cigarette packets a day in an year, that would amount to 3 pack year every year. So somebody who has smoked for more than 30 pack years is at a risk of lung cancer. Then you should consult your doctor, maybe go for a non-contrast CT test. Similarly, if somebody has a urinary complaint or family history of any prostatic disease, then after the age of 50, something like a digital rectal examination is done for prostate examination. Similar, one can undergo a cervical screening after the age of 21. So there is a protocol for each and every malignancy, but what I would like to put your stress upon is one which is most applicable and preventable, which is there in the ladies, the girls. Pap smear should be done after the age of 21 and mammography after the age of 40. And any individual, be having smoked for more than 30 pack years or any symptoms, should undergo a NCCT test.
Okay, thank you, sir. Just the last one we can take, I guess. That is, does turmeric helps in prevent cancer? So that's a very herbal remedy.
So, very relevant question, I would say. So we have something known as a curcumin, which is a form of a turmeric only. The problem with taking these products is that they usually are not absorbed very well in the body. So now many companies have come up with some nano formulations of these molecules, which are considered to be, absorbed very well. And they are, as per their small studies, they say that the immunity of the person is boosted and, the kidney function improves. Also, the chances of malignancy reduce. However, there has not been any big data regarding the same as to get this into clinical practice. But I'm aware of many doctors who prescribe these things, and they are right in doing so because there is some data to suggest that this would prevent.
Thank you so much, sir. And it was a really fantastic question answer session. One questions and many people get answered by that. So thank you for answering our queries, sir. I now request Dr. Jitendra Pandey, sir, to extend a vote of thanks as a token of our appreciation towards Dr. Mohit. Over to you, sir.
Yeah. Good afternoon to all. I take this opportunity to thank all of you, especially our guest speaker, for making such wonderful event happen. Dr. Mohit sir, we thank you for making us aware about the role of heredity, smoking, passive smoking, obesity, whether it is a single disease or it's a complex of disease. Okay, we got quite clear about these concepts. The symptoms, stages, the metastasis. Okay, you presented these things very well to the audience. We also got a lot of myths busted around chemotherapy. Targeted therapy is one of the highlights of your talk. Okay, and personalization in cancer treatment was also highlighted by you. So we thank you for all the awareness that you have spread about screening and cure of the disease. We are really honored to have you as our guest speaker today. Thank you. In the same vein, I'll also like to thank Professor Praveen Garg and Professor Pradeep Kumar, who somehow, because of their other engagements, could not join the meet on time. But they have been quite instrumental in making this happen. So I thank them both. And Dr. Ruchika ma'am, I have no words for your contribution. And at such short notice, you could make this happen. I'm really grateful to you. Dr. Ranjan sir, Dr. Jalwani, Dr. Manish ji, for your valuable inputs and some timely corrections that we could do in our posters. Thank you for that. I also thank all our esteemed colleagues who found time to participate in this event. Our students, volunteers of the NSS, okay, for their enthusiastic participation, which was quite visible from the questions itself. Thank you all. Over to you, Ruchika ma'am. Thank you.
Thank you, sir. And especially our students, we are really thankful to them. It was for them and it was because of them. It was their concern and we all were benefited by that a lot. I now request everyone to please open up their cameras for a group photograph with sir.
And Ruchika ji, I would like to say something, that if any of one of the students have any query regarding any malignancy, or they want to discuss something regarding any of their relatives, members or friends who are suffering from malignancy, they are very well free to contact me. You can very well share my number with them.
Thank you so much, sir. That's so kind of you. We'll definitely share your number.
Ruchika ma'am, Dr. Praveen Garg sir has also joined, so we'll like to have a few words from him. I could just see his name there. So if he's there, you can request for a few words from him also.
Yes. Good evening, sir. He was there for a very
for a very small time he was visible. Let me check.
But then it seems like there must be an issue with the network.
Okay, ma'am. Yeah, please proceed then. Okay.
So everyone can open up your
camera. Yeah, he's
there. Madam, koi baat nahi.
Thank you, sir. Thank you for coming. Sir. Thank you for coming, sir.
Good evening, Praveen, sir. So our ever young, dynamic.
Sir is there. There is no voice.
Dr. Praveen Garg sir is here. I request sir to please share a few words with us.
Thank you, Ruchika. It is indeed a great pleasure that on such a moment, Jitendra Pandeyji for NSS group has convened this very necessary program on cancer. His time on this occasion, and I wish it will be a great lecture not only for the students but our faculty also. As we know, as a layman, about cancer, basically to prevent cancer, the basic thing is to improve our lifestyle and food habits, daily routine, exercises. These basic routines are give more importance to avoid such kind of diseases. And second step is, once it is diagnosed, we should not worry. In this age of technology and the instrumentation and advanced medicines, everything is curable. So I think Professor Agarawal will throw more light on such aspects, to how to prevent cancer first of all. Then if it is there, we should not worry, we should not lose hope if such kind of diseases are there. And with these words, I again thank to all Pandeyji for organizing this program, Ruchika madam, Lakshana ji is there, I am seeing, and all the participants also, and wish it will be a very useful talk by Professor Agarawal. Thank you, madam.
Thank you, sir.
Thank
Indeed,
you, madam.
your words are true, sir. Dr. Agarwal has surprisingly talked about our Indian ethics and lifestyle, and our homemade remedies and their importance in our life. They've talked about it, sir. So definitely we've benefited from this. So say cheese, everyone. I'm pinning, sir.
So she is also working on cancer, immunological cancer, on the breast cancer.
All right, sir. Oh. All right, the photograph is done, and thank you so much, sir. We are really delighted, and there are no words of appreciation that we have for your input, sir. Out of your busy schedule, you took out so much time to share, all this information with us. Thank you. Thanks a lot. Now, this will be followed by a small quiz for our students. So, those who want to, please stay with the quiz. It will just be a 10 minutes quiz. And Dr. Akanksha Singh will conduct the quiz. Over to you, Akanksha, ma'am. Thank you so much.
Thank you, Ruchika. The pleasure has been all mine. Thank you. Okay.
Thank you, Ruchika, ma'am. We will now start with the quiz. And for the quiz, we'll show you the questions through presentation. And all the participants have to answer by writing their answers in the chat box. And only the first 5 fastest answers will be considered for the reward. So we will give you a participation certificate. So only this is very important to make things in your mind, that only the first 5 fastest answer will be considered. So you just write the answer in your chat box, and we'll consider only those who will write fastest. All right?
Right, ma'am.
Okay, so here's the first question. What is cancer? I hope the slide is visible to everyone.
Yes, ma'am. The slide is visible.
Okay.
All right, everyone, start typing. I am also participating.
Okay, so the answer is, it is an abnormal, uncontrolled multiplication of cells. Second question. Why normal cells do not show uncontrolled growth? So you have to write number 2, which question's answer you are writing, you have to just write it. Answer 2, and then write the answer. Okay?
In the number of the question also.
Yes.
Along. Yeah, correct. Okay.
Okay, so the answer is because of contact inhibition. Third question. Cancer that is confined to the place of its origin and do not spread to other parts is so you have to write the type of cancer, which type of cancer is confined to the place. Okay, so the answer is benign tumor.
All right, number of answers. Wonderful, students.
And fourth question. Across the globe, the most common type of cancer that kills man. So specific to man. Okay, so answer is prostate cancer, prostate gland cancer. All right, next question. What is carcinogen? The answer is cancer-causing agents. Carcinogens are the cancer-causing agents. So we'll move to the next question, which is, worldwide, which is the most common cancer that kills women? Okay. So correct answer is breast cancer. Next question. How cancerous cells impact normal cells? Answer is, it is due to active division and growth. Cancerous cells starve normal cells by competing for nutrients. Okay. 8th question. What kind of foods are linked to colon cancer? What kind of foods are linked to colon cancer? And the answer is processed meats or processed food also. Any processed meat is the answer.
So now that you know the answer, students, please stay away from a lot of junk food that we've fallen for these days, right?
Yes, yes. Next question is, what is the origin of the cancerous cells? Which is the site from where these cancerous cells originate? Okay. And the answer is monoclonal antibodies. Next question. Nearly all lung cancers develop in, so you have to answer in which tissue? All right, so the correct answer is the bronchial tissue. Okay, that's all. So we have got these 10 questions, and the result of this will be announced tomorrow, and the result will be uploaded on the college website under NSS head, right? So you all can see your result there, and the winner will get the participation certificate. All right. So that's all for today. Thank you everyone for participating here. Thank you all the teachers and all the students for making this talk a wonderful session. Thank you everyone. Thank you Ruchika ma'am. Thank you.
Akanksha ma'am, I would like to especially thank you for such a wonderful conduct of the quiz.
Thank you so much, sir.
A special thanks to you, ma'am.
Thank you, sir. Thank you so much, sir.
Thank you, Pandey sir, for this wonderful opportunity to know about floating this idea. This was very good.
Yeah, it was chance, but very quickly arranged, ma'am. Thank you for that.
True, sir.
Yeah, it was just that chance that it happened. Otherwise, it would not have happened. Thank you.
Did not hear anything from Ranjan sir today.
Ma'am, I said the answer that was wrong, so I kept my. I thought that I would not spoil myself.
So you are not getting any certificate, Ranjan sir.
I wrote cancer for that, and then I realized that students are attempting it far better, so I left the place. So I said, no more attempt. Hope
students are much more educated than we are upon issues.
Okay. And I was not prepared for the examination too.
So now you understand what our students would feel when you shoot those, questions in your class.
The random questions in the class, sir.